morning, everyone. I'm Megan Culliff, along here with Scott Micklin.
Good morning, everyone. Monday, May 18th, 2020.
Monday, May 18th, 2020.
Yeah.
Do you know what today is, Scott?
Monday, May 18th, 2020.
Yes.
But you mean there's more?
There's more.
Okay.
Yeah, it's the anniversary of the Mount St. Helens volcanic eruption.
That's true.
Happened in 1980.
That's right.
Yeah.
That's a long time ago.
That was a long time ago.
Do you even remember that? No.
I don't.
No,
we don't have to
before
go
your time.
into this, but I just wanted to mention it. I feel like it's one of those tragedies that are like, oh my goodness, this can happen to us, which is kind of where we're at now, right? We never imagined this could happen to us.
No, we didn't.
Who knew?
Who knew? Pandemic.
Right, pandemic, or that you could be living in Washington State and be covered in ash.
Right.
It's crazy.
So that's true.
So
our world.
It seemed relevant.
At work.
Our world at work.
Right.
Yes.
So
our big, dangerous world at work.
Well, it is these days. That's true. But anyway, yeah, so that is true. And so we welcome everybody to our program, and we thank you for joining us. This is our Monday through Thursday live streaming, Facebook and YouTube, where we get to share local information for our community about the coronavirus and all the different things that are being done in the community to address it. And so we're going to be joined by San Regional Medical Center's Chief Medical Officer today. In the next few moments, he'll be calling in to visit with us a little bit about the conditions at the hospital. And so we're looking forward to that.
Always looking forward to that.
Definitely.
We love ourselves some hospital interviews.
Yes, you do. We do.
You do. I really do.
You're ready.
I'm so ready.
Exactly.
Let's do this.
Exactly. Let me show some numbers from the weekend.
Cue up the numbers.
All right. Stand by.
While you do that, we can recount that San Juan College finished their drive this past weekend to the tune of thousands of supplies gathered. Especially a special shout out to Bayfield.
Yeah.
Who brought in a massive truck of supplies, we hear. Didn't they?
Lots of stuff.
Lots of stuff, yeah.
Like carloads of stuff. Exactly.
Yes, I believe the organizer, Danielle Sullivan, was like, is this some weird drive-by graduation thing?
Right.
And they were like, oh, no,
that's
a bunch of supplies.
And we have a comment on Facebook. Somebody wants to go fishing. Oh, you can't see that.
Yeah, I can't see. Go fishing where? Is that just...
Just go.
Just like...
The comment is, heck with Scott. Heck with it, Scott. Let's go fishing.
Oh.
So that's an invitation.
I like heck with Scott better.
I know you do.
Yeah. Never mind, Scott. Let's go fishing.
There you go.
There we go.
Heck with it, Scott. I don't think it's heck with Scott.
No,
Yeah.
That would be sad.
It would be.
Like to publicly heckle you, too.
Right. So there you go.
We don't like public heckling.
No, not on the air.
Which
is the public part. That's right. There you go. All right, everybody.
Okay.
Here we go.
Here's the numbers.
Let's take a look at where we are today. So we're almost at 6,000 cases in New Mexico. Another 97 reported on Sunday. Again, the state gives that little disclaimer for Mondays saying that the Sunday numbers all the labs aren't getting them their numbers on Sunday, and so there could be more tomorrow, but that is the latest from the state. We had another 32 cases in the county yesterday, and again, we're at 1344. There were 6 additional deaths in our state, and San Juan County had one of those, so now we're 85. And those numbers have been kind of adjusted if you're kind of watching those. The state sometimes takes some of those death numbers away from us if they find out that the person maybe lived somewhere else, even if they passed away here. But if they passed away and lived in another county, they would be assigned to that county.
Right.
It's kind of how that works. So those numbers are kind of being reviewed. And, of course, that's good. Almost 1,755 recoveries. The number 16 more over the weekend. So that's good news, too.
That is good news.
So there's that. So we did have that. And, again, those are the numbers there. The Navajo Nation from over the weekend had a total of like 262 additional cases since like late last week. So it seems like a big number, but there were several days' worth of results in there. But no new deaths at 140 deaths across the reservation. So there is that.
This is what I hear about opening up, is that the numbers have to be trending downward for at least 14 days.
Right.
And the infection rate, we hear a lot about that, like it was sort of 1 to 3, every one person that has it infects 3 people or something, but as the infection rate decreases to an average of less than 1.
Correct.
These are the criteria I heard this morning.
That's what the state
This is what the state is saying, yes.
The governor and her cabinet secretaries
right.
have been talking about in their press conferences. So we understand those kind of gatekeeping
Gating criteria.
Gating criteria that need
That
to
was the
come into play.
phraseology.
Thank you. That's true. The other story, of course, San Juan College going to have summer classes online because, again, classes continue here at the college, and so the plans are to at least start the summer semester online. We're still waiting for a decision about the fall, as I'm sure a lot of folks across the state are too. Some other college systems, university systems in other states have already announced their plans
University
for
of
the
California system.
fall. One of the biggest ones, right? They're online.
Huge. I think it might be the biggest one.
It could be, but they're going to be all online this fall, right?
I know. I hope that they're not trend-setting. I think if you think about this graduating class, and so they're like, okay, we don't get a graduation, we don't get graduation parties, but we get to go off to college in the fall, and now it might be like, ooh.
Yeah. But safety, that's the other part of this, and I think for schools, Solomon College does not have this yet, but for schools with on-campus housing,
right.
That's
it's
a big question, right?
It's a big question.
And so how do you have folks living next to each other, with each other, roommates, and
communal bathrooms,
and still have this issue?
Right.
So that's part of the decision-making process for them. So
correct.
We are awaiting those decisions. Again, we had, I guess we'll shout out to KSJE because we had San Juan College High School.
Shout out to ourselves.
We will. San Juan College High School graduation virtually was Saturday morning. It went off without too many hitches, so that was good. We appreciate that.
I didn't hear one hitch.
That's good.
I was impressed.
We had all the superintendents. They had all the superintendents from all the school districts congratulating the students. We had all the students, of course, the 60 students that were graduating. So we may see more of those, and we'll see what happens. But I think there's a lot of schools that are deciding what to do, because I know a lot of folks would still like to have the kids walk across the stage, kids and the young adults.
I think that dream has died.
For now.
Okay.
For now.
Well, for this
year.
Right. Oh, yeah, this graduation season. Oh, my goodness. No, I'm not talking about indefinitely.
Right.
We can't be having that. We got to figure that out.
Yes, that's very true. So there you go. Let's go to the phones.
Great.
Shall we? Okay. And we'll get the phone here ready to go. Good morning. You're on KSJE.
Morning, Scott. This is Dr. Bob Underwood over at San Juan Regional. How are you?
Hello, Dr. Underwood. We're fine. Thank you for joining us this morning. We appreciate you calling into the show. And you are, of course, the chief medical officer there at the hospital. And so if we could start by just kind of giving us a stage setter, what do the cases look like at the hospital today, and how does that compare to maybe last Monday?
Oh, yeah, absolutely. And so first, before we get going, I want to say thanks for having us on a regular basis. It's really great to be able to talk to our community. I also wanted to give a shout out, as Chief Medical Officer and as an emergency physician, this is National EMS Week. So I wanted to say a big thank you to our first responders, our EMS folks that are out there literally on the front line. I mean, they are out there interacting with the public on a regular basis, going and picking up the patients wherever they may need to go. So a big shout out to them. I've worked closely with EMS my entire career, so wanted to give them a quick shout out. So this morning we have 124 patients that are currently in-house. This is seeming to be trending in a good direction. And so we've got 124 that are in-house, 47 patients on our COVID floor. And remember, as we've said before, that we separated our hospital out, so we have one floor, which includes our ICU, that is nothing but patients that are COVID positive. We have 4 patients that we're still waiting for test results to come back. And then we've got 4 patients that are intubated in our ICU. Now, we do have a total of 10 patients in our COVID ICU, but only 4 of them are on a ventilator right now. Again, this seems to be trending in a good direction. If you go to the Department of Health website and look at the number of positive cases that have been happening in San Juan County, those are trending well. In addition to what we're seeing at the hospital. Now, we're going to be lagging, of course. The positives don't immediately necessarily get admitted to the hospital. Often the hospital will trend a little bit behind what we're seeing in the county in terms of positive cases. But overall, we've kind of got our fingers crossed. this number is up and down, and so we put some mathematical factors in to try to flatten the variability in the reporting, and that is looking actually pretty good right now.
Thank you. That's good news, Dr. Underwood. We've seen some of those charts from the county. I know that they compile about maybe, and the hospital too, I think those 7-day averages, and that's kind of what you mean about trying to take out the daily variations in these numbers. And if you average them out by a week or so, that helps to get us a maybe better overall picture on trends.
Absolutely. There's always going to be some day-to-day variability, and that has to do with, of course, weekends. It has to do, for example, we run our external assessment area 3 times a week, and so on Monday, Wednesday, and Friday, we do more testing. And so that will cause a natural variation in terms of also the numbers of positives that we see. And so, yes, we try to do this rolling average to look at what that trend really looks like without having that day-to-day high variability that can confuse the issue. If you're trying to look at a graph and one day you see 0 and the next day you see 70, that's hard to understand where that's actually going.
And speaking of testing, we heard from Jeff Bourgeois at the end of last week that testing, at least this week, is not 3 days. Is that correct?
There's been a change, maybe just having it,
and is it a temporary change,
Monday, Wednesday?
So there was also a Department of Health that is testing this week in our local area, and so I'm not sure what days those are going on, but for our drive-through screening, I was unaware if there was a change. It may be, but I was unaware. I just spoke to somebody a little bit ago, and I did not get that word.
Understood, Dr. Underwood. We understand. But that's a good thing, right? We always hear the more testing, the better, right? Even if our case numbers go up, it's important to know who's been infected, who's been exposed, and even for those individuals, I guess, to understand too, right? If they have tested positive for this illness, right? This virus.
Absolutely. And so if you look at any, from globally, any steps that lead towards improving the spread of the pandemic, it almost always starts with testing. And there are multi-steps to that, but the first one is identifying who may or may not be infected. And if you find people who are infected and they know, then they're naturally going to take some appropriate precautions around spreading the disease. The second phase of that, which is really where our state is getting involved in a great way right now, is actually what we call contact tracing. And so, as you have heard, some people will not show symptoms of the disease until after they've been shedding the virus for a while and potentially conferring the infection into other people. And so one of the things that we do is we will find that patient who is now testing positive, and Department of Health is acquiring a number of folks to help them identify who those contacts were and then who their contacts were in order to try to find out and stop the spread from going any further for those people who may have been infected and don't even know that they are yet, and then stop them from spreading it as well. And it's all a matter of trying to decrease the number of potential exposures, the number of potential virus exposures that people are receiving. And that's really what all of these things are about. When we talk about all of the precautionary things that we say, 6-foot distancing, wearing a mask when you're in public, it's not that any one of these things are ever going to be 100% effective, but it's all about decreasing what we call R effective. The R value is how often this is being spread to someone else. And if we can get that R effective down, then it decreases the spread of the virus from one person to the next. And of course, we've talked about it many times, trying to really avoid that spread into the vulnerable populations.
Great. And switching gears a bit, we know there's a very, very broad array, it sounds like, of treatments that are happening for this. And so if a patient comes in with COVID, what kind of treatments are you guys using over at San Juan Regional?
So this is exciting. So the remdesivir, which is the one that you probably heard a lot about, which is an antiviral medication, we recently got a shipment in. So those came through the New Mexico Department of Health and in bulk, and the New Mexico Department of Health has looked at what are patient volumes, what is the number of COVID patients you're seeing, and then distributed out that medication to a number of different facilities. And so remdesivir is one that, like towards the end of last week, we got a good number in, and we're anticipating more in order to treat the COVID patient. And that's an antiviral. There's been some other ones and that are out there. Of course, the hydroxychloroquine, azithromycin combination therapy, and that one has had mixed results. And the other thing that is I think it's important to point out, Megan, around this question really is that normally we would go through medications in a very defined clinical trial where you give some people the real medication, some people don't get the real medication, that's called a placebo, and even the people giving the medication don't know if they're giving the same one or the false one or the placebo. That's called a double-blinded study. And through that, you do a statistical analysis of what that outcome really is. We have not had time to do this. So a lot of these medications are going on anecdotal information or some trials that are not as disciplined as we would normally do. So we don't want to say, as the Department of Health would say and as the CDC says, none of these are miracle cures. We are not 100% sure that they all work or they don't work, but some of them show promising results, and that's where the remdesivir is right now, showing positive results from some of the data that we're seeing, but again, nothing clearly defined as we would normally do something in a really well-controlled, double-blinded clinical trial.
Great, thank you. And also, what about this possibility of getting sick again? So lots of talk over immunity. If you catch it, do you have indefinite immunity, or can you get sick again? Are there any updates on that?
No, and that's a great question, and that's been something that we've been waiting for some of the results to come out. I was actually reading something about convalescent plasma this morning. It's a study where they've identified one very particular antibody that does seem to be conferring some immunity. But again, we haven't had the time. Got to remember that, it was March 20th when we had our first case here at San Juan Regional Medical Center, not that long ago, not even 2 months, to do the defined studies that we need to be able to do to prove these things out. Now, there is some promise around convalescent plasma, which basically would give you the whole array of somebody who's already been exposed to the disease, all the antibodies that they have developed, and try to administer that to a patient who is currently ill. Again, the absolute way to do that within a clinical trial has not been done, and so the best way to administer that to patients has not been fully defined. It is showing some promise, but the best would be if we can really clearly identify what those things are, the antibodies and the antigens which can confer that immunity, and that's where vaccines come from, that's where quote-unquote antidotes come from. Again, very early in the process, and I mean globally, we have not had the opportunity to do that level of research yet.
Understood. Dr. Underwood, can you talk about maybe the vaccine part of this too? Because I know, as you say, there's a lot of work globally, scientists and doctors and folks that are trying to come up with what would make for an effective vaccine, and a lot of this is being fast-tracked. I think maybe you can comment too in your career. I mean, normally to come up with a vaccine, it's at least 18 months, if not longer, and everything is really seeming to be accelerated, understandably so, but you have to go through these trials and see how these things work with different populations, correct? And so it's hard to really throw it out to everybody when you're not sure how it's going to interact with everybody.
Yeah, absolutely. You're absolutely correct, Scott. Yes, normally it takes years to get a vaccine through a normal process. And there are already some vaccines that are in human trials, which is unprecedented to think that it has gone that quickly. And that has a lot to do with technology. It also has a lot to do with the urgency of the situation, with how fast it's continuing to spread, how many people are continuing to become infected. But normally, what you do, and in a human trial, is the vaccine is administered. This is after it's already been through animal trials, typically. And then it is administered, and then you study that population who got the vaccine to see if they get the disease. And that will give you an idea of how good the vaccine is at fighting against the disease. In other words, did it confer an immune response in the patient so that they now no longer get the disease? There's been some good trials that they've done in animal models that seem to be promising as well. And so it's moving forward, certainly moving forward faster than anything I've ever seen. I mean, I've been involved in medicine, I don't want to say how long, but 30 years since I got my first job in a hospital way back in 1990. And yeah, I have never seen anything like this. Now, and there are two components. One is urgency, the other is technology. I mean, if you think about it, nobody knew this existed before basically New Year's. I think that's how everybody's looking at 2020. That's about when it was really identified, and to be able to have identified the virus, found that the virus was an RNA virus, sequenced the RNA inside that virus, was done within a matter of weeks. And that would have been, when I became a physician and got involved in medicine, this whole polymerase chain reaction sequencing thing was a new thing. It would have been somebody's, greatest dream that we would be able to do what we've already been able to do. So is it fast enough? Of course, there's lots of people out there who would say no, especially those who have been affected by the virus. But, man, if you put it in perspective, the things that science has been able to do is really astonishing, just a comparison of what was a couple of decades ago.
Agreed. And I want to return to contact tracing a bit here, because we've heard a lot about what other countries are doing using cell phone data, et cetera, et cetera. But how's it working here? Can we have a little more details on that? Like, if somebody came down with COVID, what exactly does contact tracing look like? We know that it's related to who did you come into contact with, but then how is it followed up on, as far as are there check-ins on, are you staying in quarantine, et cetera? Are
you getting any guidance from the state on that, right, Dr. Underwood?
So this is actually something that's newer. This was based off of phone calls that we literally just had last week. And we actually gave some guidance to the state in terms of contact tracing within our own community. Most of the time it's done by telephone, Megan, where you get the information and then you call a person and then you talk to them about everybody they've been in contact with. And anybody who has come in contact with, you ask them about, are they showing any signs or symptoms, and you determine whether or not they need to be tested. Often they would be tested as well. But then you also give them very clear instructions on what they ought to be doing, what they ought not to be doing in terms of exposing other people. But then you ask them about their contact tracing. Now, when we were talking to the Department of Health last week, one of the things that we pointed out as part of our contact tracing may need to be on the ground. We need to look at, for example, field workers. What about the person who may have been exposed? And they may actually be infected and confer the disease, but they don't have the ability to stay at home because they need groceries and medications and water, et cetera, depending on where they live and what their socioeconomic status is. And so being able to identify those individuals and provide them with the level of support that they need so that they don't have to go out and expose other people may also be important. So there's many, many facets to true contact tracing, and it takes people to be able to do that, and it takes some training. And, to tell you the truth, there's not a lot of people out there that are trained in contact tracing or epidemiology.
Interesting, but it sounds like that's kind of the way forward, don't you think, Dr. Underwood, as we try to move to open more things up and get out and get back into small businesses and maybe some organized gatherings while still maintaining our physical distancing, but that we are going to try to slow the spread. But obviously, I think people are still going to maybe be at risk, and so this contact tracing, we're going to hear a lot more of that, and maybe some job opportunities for folks, because we're going to need a lot of folks out there doing that, I think.
Yeah, I think that you're right. I think that for the time being that's our next step, and it will be something that will become part of what we normally do until there's a vaccine or until we have true herd immunity. You've heard that term thrown around a lot too. Then yes, contact tracing is absolutely going to be something we're going to have to take advantage of, that tool and our ability to slow the spread.
Very good. Well, Dr. Underwood, we appreciate your time this morning, and thank you. And again, please extend our thanks to all the folks on the front lines there at Salem Regional Medical Center. I know they are doing a hero's job each and every day. We hear some of the stories, and I know there are a lot more. So thank you very much.
Absolutely, Scott. And I'll tell you what, I cannot be more proud of this team. I mean, to see the respiratory therapists, the nurses, the physicians, and how they are pulling together in really unprecedented times. And a lot of times, like I said, this is relatively new, and so they're acting on incomplete data often and coming up with novel solutions to move patients where we need to move them in terms of how do we get supplies, how do we get ventilators, how do we work together. It's all very new, and the hero's effort, as you said, of those clinicians at all levels has just been amazing for me to watch, and I'm really, really proud of this organization.
Well, we appreciate them and you, and again, as you mentioned, the numbers are looking good, and again, the whole idea was not to overwhelm our hospital and our frontline workers, and so far that seems to be going the way it's supposed to be, so that's good news too.
Absolutely.
Wonderful. Well, Dr. Bob Underwood, thank you for joining us this morning. We appreciate it very much.
Thanks, Scott. Thanks, Megan. I appreciate it.
You're very welcome. That is Dr. Robert Underwood. He is the Chief Medical Officer, Salem Regional Medical Center, joining us on our COVID-19 local information program today.
That's right. They've been so faithful to us and the community.
Been. We appreciate that.
We
do.
And
it's great to get information right from the source.
From the horse's mouth.
So to speak, and there
so
you go.
To speak.
So there you
Not
go.
that you look in any way like a horse, guys.
No.
It's just
it's a
the
figure of speech.
colloquialism.
It is. But we appreciate that, and hopefully the listeners and viewers do too, and I think that they do. So, So thank you everybody for joining us. And we have faith-based communities, right? Or face-based communities, right?
Well,
you all
usually
have faces.
faith-based communities are also face-based communities.
Yes.
But, we've seen a lot of interesting stuff going on. So you and I were commenting just this past weekend on a church that was using radio transmitters to do a drive-in church
like
service.
a low-power transmitter
like
to
a local,
broadcast to people's car radios.
Small wave radio.
Wow, it's contagious.
Small
Lock us down.
Wave
my.
radios.
Yeah.
Yes, and so you asked me if my other day job would do that, and no, I think is the answer. But
okay.
Yeah, but in thinking about phasing in, it is definitely true that we hear congregate settings, right, for example, are hit very hard.
Yeah.
So that usually does not mean congregate settings in the congregation sense, church-wise, but we keep hearing all these horror stories of churches that decide to open too soon or too recklessly, and it's tragic. I mean, there was a story about a church in Washington State that had a choir practice, and over half the choir got sick, and a good 10 of them actually died, and they were actually very careful. See, that's the thing. It's not just churches that are like, whatever, hug everybody, nothing's different, it's all the same as it was. That's one thing, but to have a church be very, very careful and still have a super, super virulent outbreak is something that we should heed.
And I think...
Yeah.
I didn't mean to interrupt
you. Well, I was
saying,
so we, that is not on our radar right now to open in any way.
At First Presbyterian
Right.
Church. Right. Other churches may be in a different place. And we're seeing across our state, right, churches are being allowed to, except for here, reopen with smaller occupancies.
Sure.
And, of course, I think even for the small businesses, I mean, I have to agree that, it'd be nice to get everything reopened, but nobody wants to have an outbreak at their business
Yeah.
or their church or their school
because
or
nobody wants a
anywhere.
lockdown again, right?
Right.
To start to emerge from a lockdown and then to have the hammer come down again is just how
Right.
many times can you do that? And
Or no one wants the story that says, we're traced 20 infections to this grocery store.
right, or this.
Who
Or
wants
the
that?
Presbyterians.
Right.
Like, thanks a lot, Presbyterians.
We don't want that.
Infect the town, why don't you? Well, and I think also one thing to consider is, especially with organizations that rely on hospitality, right? So even civic organizations,
Sure.
they meet all the time in groups. And what is most hospitable? Is it hospitable to say we're going to see each other in person again, but we're going to police how far you sit? We're going to police whether you hug or not. We're going to tell you no, no, no. Or is it just better to wait so that when you do reopen, it's a more warm and fuzzy event?
Right.
So I think that's another thing that we consider, and I know that we're not alone in that, and that churches are not alone in as far as it comes to group meetings, right, and figuring out the best way to do that. So we are just advising people
They're
to
on it.
wear a mask. Seriously, do your part. Wear a mask.
Wash
There's
your
nothing,
hands.
Nothing courageous about not wearing a mask. It's just what we need to do right now. So
I think that is, as we get more closer together, that's how you can help protect others by wearing a mask.
that's right.
If you want to get back into
it's actually quite simple, right?
It should be, but if you want to get back into the stores and have had some of the smaller stores open, I think, if I'm in a store, I feel more comfortable if everyone's wearing a mask, just because you don't know. And that's the big issue with this virus.
Love thy neighbor, wear a mask.
Okay. There you go.
There you go.
I like that. Well, thank you, everybody, for joining us. We are going to wrap it up, I think. Is there anything else that we need to share? You mentioned the San Juan College supply drive.
Right.
So that truck should be leaving today. To deliver all those great supplies to the Navajo Nation, our friends and neighbors. And we appreciate all the support on behalf of San Juan College. And it's wonderful. So,
It's always a good thing.
Great to see. And stay tuned. Of course, we'll be back tomorrow. We're going to talk about kids tomorrow.
Kids!
Kids.
The kids.
Who can't love kids? And keeping them healthy.
Who doesn't love a good, healthy kid?
That's right.
That's right.
So Dr. Harrington, Dr. Preston Harrington, pediatrician, is going to be joining us on the program tomorrow to talk about COVID and children, because
Right.
we're learning more about that.
More and more about that. And so we found it important to bring him in.
Yeah.
Again.
Well, because
Tell us about
originally,
the kids.
just like, the story is just evolving, and it just, as a media person, to me, some of my well-meaning friends will share a post from maybe March that is already out of date.
Already out of date.
And
right.
I feel bad pointing
Right.
that out, but
Right.
but it's incorrect information.
Right.
And even what we know about the virus and children
Yeah.
was one way in March, and it's different in April, and now here we are in May, and now
It's-
there's even new information. So,
yeah.
So we think it's important.
Constantly evolving.
Yeah. So we think it's important to talk to these folks
That's right.
about some of these newest, what we know and what we think we know about kids and coronavirus. So that's
There's
tomorrow's
the
show, everybody.
known knowns and the known unknowns, right? Isn't that how that
Yes.
works?
Sure.
There's a graph
You
somewhere.
say so. Yep.
It's like a
Okay.
quadrant. Okay. Look it up. The known unknowns.
All right. There you go. And on that note, we will go into the unknown.
We know nothing.
And wrap up the show. So, thanks everybody. Stay well, stay safe. We will see you back here tomorrow morning, Tuesday at 9 a.m. right here on Facebook and YouTube, and rebroadcast every afternoon at 5:06 p.m. on KSJE and at noon on our radio partner KNMI. Have a great Monday, everyone.